We are
We are
live.
live. Hi, everybody. Thank you for joining today. Hopefully, you've been able to join some sessions so far. And if so, hopefully it's not the first time that you hear my voice. I'll just intro again. I'm Jenna. I'm the Nora from Canada. And I am so thrilled to have with us today three incredible people. Vincent's taking all the credit right off the bat. We have here Dar, Vincent, and Rita. They'll be doing brief intros as well. I have been so blessed, so fortunate to be able to work with these three phenomenal people over the past, oh my gosh, 3 years now, almost 4 years.
Oh, goodness.
It's been a while.
You're making me feel old.
I've had the incredible opportunity to call them my mentors, my teachers, and above all else, my friends. So I want to thank you for that. And without any further ado, we'll turn you over, and there'll be questions at the end as well. So please feel free to use the comment bar that you should be seeing on the side of your screen if you're logged in via Google Hangouts.
Technical question. How do I switch to slides?
I am doing that for you now.
She's also our tech support, not just our friend.
We have Vivian for that, thank heavens.
Yay.
There we are. All right. Oops. There we are.
Alrighty, so here is our presentation.
Can they see us now or just the screen?
Just the screen.
Okay, so I can take
All right. Breaking down medical barriers to better serve transgender people. I want to say from the beginning, disclosure, we're not being paid by anyone or being coerced to speak against our will.
We're not being paid at all, actually.
And Jenna put this slide in here, and I love it. And so we kept it in here. You are not a drop in the ocean. You are the entire ocean in a drop. And it's important because when you are working with people who are transgender, you may be the person that supports them the most, or you may be the only person that is affirming their identity and keeping that in mind, or you can be that starting point, that is the light at the end of the tunnel. So to that person, you can be the ocean.
Professional affirmation is critical. I really needed it when I came out. Yes, you can have all sorts of other people support you, but having a professional, especially in the healthcare field, affirm and support you, that saves lives.
I'm not going to spend too much time on the terms under the umbrella because we only have an hour. But some of the things that are most important to point out is the fact that gender is not a binary. You're not necessarily either male or either female. It is a continuum, and transgender is this massive umbrella term that encompasses anyone whose gender identity does not match the sex that is assigned at birth. And so we have people who are more binary with their gender identity, who transition from male to female or female to male. And the term transsexual used to be really popular, but it's fallen out of favor here in Canada because of how the term is sensationalized over the years. And many people who would technically be considered transsexual still will prefer to use the term transgender. We also have identities like genderqueer and intergender, agender, non-binary, and people who just don't identify as either male or female. And these are all valid identities. These are identities that are protected under legislation here in Ontario, and people who also have the right to chosen name and pronoun. And some people will use gender neutral pronouns. They and them is pretty common here. There are also other ones, hem, zir, them, it depends on how the person identifies and feels comfortable identifying. And I want to point out another really important thing about the way we look at gender and talk about gender, because this idea of gender as a binary, as either male or female, didn't exist in many, many cultures. Here in Canada, we have two-spirit people, and these are individuals who cross those gender binary ideas, and these were people who sometimes may have identified more around sexual orientation, but these were individuals that were highly regarded, and then the European settlers came and that changed that. And thinking about how we feel in Canada about male and female and what is a masculine trait and what's a feminine trait, that was brought over by Christian European settlers. A very interesting infographic, and it's a really simple way of just showing the differences between gender identity, gender expression, sexual orientation, biological sex, and it shows that there isn't just one or the other, there's so much in between. And a very simple, in a nutshell way of remembering the differences between gender identity, gender expression, and sexual orientation is your gender identity is who you are when you go to bed. Your gender expression is how you look when you go to bed, and your sexual orientation is with whom you go to bed. I'm all sass. I'll say that right now.
He's a lot of things, so we'll give him the sass for now.
When talking about healthcare and talking about the LGBTQ plus community, talking even specifically around the trans community, a lot of elevated risks that may exist, and things like higher rates of obesity, heart disease, asthma, STIs, higher rates for addiction, drug abuse, alcohol abuse, smoking use, depression, and other mental illnesses. I want to dispel the myth that we do not experience intimate partner violence. There is still intimate partner violence within the LGBTQ plus community. Breast cancer, colon cancer, any other disease that anyone else can get, we can get as well. But for a lot of us, we're not getting screened or tested because we are afraid to come forward. And that's something that I'll talk a little bit more about later. And we're wondering why we're in a situation where you're not feeling like you're worth taking care of. You're not going to be taking care of yourself. And in some places, especially when you're looking at northern and rural communities, like where we are in Northern Ontario, there's decreased access to healthcare. And I'm sure a lot of the people watching, you're not located necessarily in a metropolis. You may be in a community where it's hard enough to find a physician or a medical practitioner. On top of that, you have to find one who is trans friendly. And that can be difficult to find.
Trying to find someone that you can trust to tell is an enormous burden. And mostly we hide, not going for healthcare.
Now there's a circle around the Y. Forgot about that. We'd like to give you our perspectives and talk about our experiences as patients, some of the things that we have gone through. And I'm hoping that these personal stories can help not only be an interesting way of looking at how we interact with the healthcare community, but also as practitioners and service providers, how you can see this and go, how could I make this work in my practice? And how could I learn from this? And we're going to start with Darlyn. She's the beautiful blonde in the picture.
Darlyn is blushing right now as we say this.
Excuse me. I hope I'm talking loud enough because I'm not sure, but
That's perfect.
okay. Well, going back, I knew from a very early age of what thought I was different. And through all the years growing up, it has been a very hard time for me. However, what's going on today, and I'm seeing this, is I can talk on the experience of, and the fact that I see a lot of suicide within the transgender community. And I know how it feels like because I tried to do it myself when I was 20 years old, or 21, somewhere around there. And it didn't work. Well, I'm happy that it didn't, but that's how much it gets to you. So I lived my life all through, as Vincent pointed out, that healthcare is extremely hard for us. We're scared to go. And for me, I was very fortunate here a few years back. I went to my physician, a new one, and the reason for that is my oldest physician was the same age as me, so he retired. Well, after the second visit to him, I turned around and, well, I better, so I gave him my card with the picture on. And from that day forward, that was one of my best days because he went right out in front of me and he says, okay, let's talk. And him and I talked for about 45 minutes, and he wanted to know everything about me and what he could do to help me in every way possible. And then I was, of course, dressed in the other persona at the time. And he says, from now on, I want to see Darlyn here. And that's the way it has been. And that is opening up a whole new world for me that I finally can be who I am.
I'll go next. I'm the sexy brunette in the gray shirt.
No, if you watch Star Wars, he's the incorrigible little Ewok. That's hair from the nose down. That's all I got to say.
I agree.
My situation was similar in some ways, but different in others. Because in my case, I am a trans man, and I've gone through my own medical transition. I started my medical transition when I was 19, and my social transition when I was 14. For me, one of the most difficult things I had to do was approach my family physician, who I knew, he's Catholic, he's conservative, has some old-fashioned ways of thinking, and did not know how well it would go over when I had approached him to provide me with my hormone injections. I had already been seeing an endocrinologist to prescribe them. He just had to administer it. And it didn't go over very well. He was clearly not comfortable with it, said he refused to be a puppet for these doctors in Toronto. I'm in Sudbury, so 450 kilometers north of Toronto, and walked out of the room. It was 5 years or so before I had gone back to see my family doctor because I was just really uncomfortable after that experience. And even now, he will prescribe the refills and everything, and he's come around a bit, but I could still tell he's not fully comfortable with me. On the other hand, I have some funny stories. So I've already gone for top surgery. I had completed that in 2011. Wonderful moment in my life. And I must honestly say it is far easier to swim without breasts But floating without breasts is harder because I had a lot of breast tissue that they removed.
Okay, he still got this thing for breast. I was just making that clear.
Other people's, not my own. And then a year later, I went for a hysterectomy. Now, about 11 months, 12 months after my hysterectomy, I had what I was pretty certain was a urinary tract infection. I had all the symptoms. I'm going, okay, first thing in the morning when the walk-in clinic's open, I'm going to go in and get this taken care of. Go in, get the cup, pee in the cup, and then go into the waiting area and wait for the physician. So I called into a room, physician comes in, and he is somebody who my sister had worked with for a while, so I knew he had a lot of the same opinions and values as my family physician. Older man, late 80s, early 90s. And he comes in and says, okay, Mr. Bold, what's going on? And so I said, I think I have a urinary tract infection. Now, my health card says male because in Ontario, at the time, I had surgery when I changed it, so I could change it. Now you don't even have to have surgery. You just need a note from your doctor to change the sex designation. So my ID says male. Here's a guy with a beard. He's reading me as a cisgender male, and he's saying, okay, the chances of you having a urinary tract infection, highly unlikely, possible, but it's more likely an STI, which I said it's not possible, it's an STI. And then he said, or there's an issue with your prostate. So I tell him, okay, what do you mean an issue with my prostate? Because I'm a bit of a smartass. So he starts going on and he says, okay, well, I'll give you a prostate exam. So I say, okay, hold on, before you lube up that finger, have a seat. And I explained to him that I'm trans, I don't have a prostate, and he certainly does not have to go looking for one. And then he said, okay, yeah, possibly a urinary tract infection, writes me a prescription, and then sends me for an ultrasound. A few weeks later, I go for my ultrasound. And by the way, it's really sadistic to tell somebody you have to be inflated like a balloon with liquids, and then they press on your bladder to do these ultrasounds. But I went, and I endured it, and I'm there about to piss myself, and the technician who's doing the ultrasound says to me, have you had surgery recently? And I said, yeah, I had a hysterectomy almost a year ago. And she said, that explains a vaginal cuff. And I said, well, that is one way you can tell, well, I still have my pants on. That would have been a gold star moment for her if she laughed at my joke, but she didn't. But it was not an issue at all when I told her that, yeah, I'm male, and yeah, I have a vaginal cuff or vagina, and who I am. And she was completely comfortable with me being who I am. And it was a great moment because that moment could have been horribly uncomfortable, or more so than it already was, because full bladder being pressed on by this X-ray wand.
X-ray wand.
I'm not a medical student, so I don't know the terms.
I love it.
But that was the experience, and there's something that can be taken from that. One, laugh at our jokes, and two, it's not an issue. So what? You're a man with a vaginal cuff. Let's check your bladder.
Okay, my
Rita's
turn.
turn. The sassy redhead's turn.
I'm the quiet one that you see over in the picture with the nice blue skirt. My stories, I'm going to start with this, trying to find a doctor to do hormone replacement therapy. That was over a 4-year search for me, because I was bound and determined they weren't going to send me 4 or 5 hours away driving to talk to somebody to get it done. And I did manage that. Actually, Darlyn and I share the same doctor, so we've traumatized that poor person to no end. But I want to tell you about two little stories about what it's like as a trans person when you're vulnerable. Remember, as our clothes comes off, our anxiety level goes up. It goes right through the roof. We don't want it. This goes back to June 20th, 2009. I was at home, one of those terrible flus were going around, one that just basically did you in for about 12 hours. I got up late, went to the bathroom to go and do what needs to be done, and I passed out on the toilet and fell into the vanity and wedged myself between the vanity and the tub. The result was that my head was turned almost completely around. I couldn't breathe. I did manage to move my head just enough to get some air. Finally, the dog alerted my family. They came in. You got to picture this. I'm in a women's nightshirt. I'm laying on the floor, and the flu, you can tell, you know what was coming out the other end. It's all over the place. And I'm jammed up against there, and they're going to have to call an ambulance. I'm extremely vulnerable at this point. I'm not presenting totally as who I am. This is hell. They called the ambulance, the crews came, the first crews, wouldn't you know it, 2 women. They were amazing with me. At this point, I'm totally paralyzed from the neck down. I can breathe and I can talk, that's about it. They get me stabilized. They have to call in another crew to get me out of there. So now we got 2 guys, 2 girls, and they're wrestling me onto a backboard, taking me out. I wish I could have died at that point. They took me to the hospital and to emerge, and then the discovery and recovery process, of course, began. I will say this, they were so wonderful with me. No one batted an eye, no one said anything. They were all very kind. At one point, of course, I was emerged for a couple of days because there were no beds to be had and things were busy. Finally, at one point, a nurse came in and she says, "I'm sorry, we've got to cut your nightshirt off of you." And I says, "Okay, that's fine. I understand you have to do it." Well, my nice nightshirt had a nice embroidered crest on it with flowers, and it was very lovely. It was a very nice high-end cotton nightshirt, women's, of course. She looked at me, and the eyes told me everything. She said, "Do you want me to save the crest for you?" A moment I really needed at that point, because that was understanding from another woman saying, "I get you. I understand you." It made my recovery a lot easier. That was a very difficult time. So that was the time things went very well for me. But I'm going to tell you about a time with a doctor in a bad spot. I've got a kinky finger. Okay, let me explain. Don't get all excited and please don't let Vincent comment on this. I have a finger where I tore the tendon off the top of one of the joints, the last joint. So of course it was flopping around, and you know they got to do all the hand splinting stuff and all that for it. So I had to go to the hospital to get all that sort of thing done. Now I went in as myself, and myself being Rita, not the yucky male presentation. So I went in, and most of my appointments there were all that way, except for one. You see, like many trans persons, I have to live a blended life. Because of family and some work concerns, often I have to cross-dress as a male. For everything else, I get to be myself. So I've been doing all these appointments as myself, and finally there was a follow-up with the specialist that had to be done. And when you know it, it was one of those days where I couldn't go and change to be myself. So I walked into the hospital, into the big waiting room, and can you imagine how I felt when they called out the name Rita, and this guy, namely me, walk over there. Then I get into the room, and of course the specialist is going around doing his rounds. He comes into the room, looks at his chart, looks at me, and he walks out. And he gets the nurse, and he comes back and he says, there's got to be a mistake. And I said, no, there isn't. I put him in a very awkward position. Here I am identifying as Rita, and I'm not presenting as Rita. It was a very difficult time for both of us. So what I want to give you out of this is we don't often always get to present who we are. And sometimes, and I'll warn you of this, you may have a person with a male body. They don't want to undress or do things, and you might find out this person is wearing women's underwear. That's not a fetish. We do that to survive. We have to have something on that relates to who we truly are. So when that sort of thing happens, would you please be gentle with us? Thank you.
When talking about healthcare, as I said, I'll get to this later, why we are afraid of going to practitioners and why we're afraid of having treatment. In Ontario, 21% of trans people avoided the emergency room when they needed it because they are trans. It's that fear of what's going to happen when I get there. 66% of trans people who use the ER and presented in their felt gender had to educate their healthcare provider regarding trans issues. For many of us, we've had to be the educators. I've had situations where I've gone in with mental health crisis. I had just attempted suicide, and I was brought to the hospital, and I was put in front of a social worker who never heard of transgender before. And here I was going, okay, please stop calling me she. And she wasn't getting why it was so important. The reason I was there in the first place was because I was sick of the way I was being treated as a trans person and sick of people not taking my identity seriously. So to then be put in a situation where I'm in crisis and my identity is not being understood and affirmed was a step backwards. 20% of trans people have been denied a hormone prescription. 14% of trans people have used non-prescription hormones. We put our health in jeopardy because we need, for those who need the hormone therapy, not everyone opts for that, but for those of us who need it, like myself, we will do anything to get it. And being the practitioner who enables us to do it safely is so important.
I almost gave in to going and getting hormones that were not prescription because I couldn't get a doctor to do it. I was trying to keep my integrity in doing it right. It became extremely hard. I will tell you this, the main reason we take hormones is not for the changes it does to our physical body. It's that we do it for our brain. I will tell you this, running your brain on the wrong hormones is hell, and you don't even know it until you fix it.
So why is this important? Why are we focusing on trans healthcare and working with trans people? When looking at suicide and trans population, 77% of trans people here in Ontario have seriously considered suicide at some point. 43% of us have attempted suicide at some point. When talking about youth, the numbers are much higher for suicidal behavior than for adults. For youth aged 16 to 24, 19% had attempted suicide in the past year, and 47% had seriously considered suicide. All ages of trans people who've experienced violence and harassment, percent of us have attempted suicide because of physical or sexual assault, and 47% had seriously considered. And many of us do experience things like harassment. Many of us do experience things like assault. For those who are still in school, 90% of trans kids here in Canada hear transphobic remarks and comments at school. And it is still a serious issue for youth. And so they may be experiencing homophobia and transphobia at school. They may be experiencing problems at home. When they come into your office, you might be that one person who is accepting them for who they are.
Please understand, we're always undergoing constant mental assault. That's what it really is.
These are numbers that are specific to Ontario. 71% of trans people here have some post-secondary education. However, 50% of trans people here in Ontario earn less than $15,000 per year. For Ontario, that is less than earning minimum wage. If 50% of the trans population were working at McDonald's, they would make more than what they're making. Is a real slap in the face when you have 71% who have some post-secondary education. And there are many reasons for this. One is due to the high unemployment rates within the trans population. And it's not because of a lack of trying. It's from the level of discrimination and harassment in the workplace, being constructively dismissed, being fired when coming out, issues where if you transition after you leave one position, so you work for a company for 10 years as John, then you leave and you're now Sarah, that company, and ask for a reference for Sarah, they're not going to know who you're talking about, and they may not be willing to give that reference. And that becomes an issue. Just less than half of the trans people here in Ontario actually have identification that matches their gender identity, that have that driver's license that says their true name, the name they chose, and has the correct marker on it for sex that matches the way they present. So even if you're applying for a job to deliver pizzas, you're put in a position where you have to out yourself in order to get the job, because you have to prove that you have that driver's license. And then you're in a situation where you're at the mercy of whether or not this person will accept you. Because if they don't, they can find another reason to not hire you. Access to medical transition is imperative when it comes to saving lives. So I talked about suicide attempts within the trans community. For those of us who have wanted to medically transition, started hormone therapy, have surgery, but have not yet started, 28% had attempted suicide in the past year. For those who are in the process of medical transition, so may have started on hormone therapy, maybe on the wait list for surgery, 17% had attempted suicide in the past year. For those who had completed their medical transition, 1% had attempted suicide in the past year. It is important to have access to medical transition. I cannot emphasize that enough. And right now in Canada, we have only one center that does bottom surgery.
What do you call firebound?
And there was an arson attempt at that center last Monday. And fortunately, in their press release, they had stated that they are still continuing on with surgeries, but it's not just the physical damage that occurred, and it's not just the time that was lost. It's the sense of security that was lost for many of us, and it was quite significant for people here in Canada who are accessing that service. And here we are in a situation where there's only one center. Things like travel can be a barrier. You may have the government paying for the surgery itself, but traveling from Vancouver to Montreal is bloody expensive. If you're making low wages, you're not necessarily able to afford that $1,000 flight. Or even if you are somebody in Ontario, driving from Sudbury to Montreal is a 10-hour drive each way. Plus you have to take the time off work, plus you have to pay for accommodations. It all adds up.
I want you to be aware of something. There's something worse than no treatment being available. And that's a treatment that is available but is denied. That is cruel. And the toll it takes on the person's mental health is extreme. The person also that's starting into the transition process, to have barriers come up in front of them so that they cannot proceed on. It's kind of like flying. Once you start, you got to keep the wings going or you fall. So if you get a certain place in your transition, and then everything comes up, no, you can't do it because your suicide risk skyrockets again. So please, when you help us with these things, please help advocate for us to keep us going along the path. That is the treatment that works.
I'm sure a lot of you have studied core determinants of health, and this wheel is great because when looking at being transgender in itself becomes a social determinant of health because it makes it harder to access the things that are on this wheel. For example, as I mentioned, employment and working conditions can be compromised for many people when you come out in the work world. Education and literacy, when you're a kid who's coming out of school and you're experiencing bullying, that's going to impact your ability to achieve that education. Your physical environments, if you're making very low wages, you may not be able to afford safe, secure, and healthy housing. Social support networks, a lot of us lose friends and family when we come out. In a lot of areas, it's hard to find peer support groups or trans support groups for people who are coming out. We're starting to see how large these gaps are, where there may be a 500 to 1,000 kilometer distance from your community to the next trans social support group. And how do you bridge that gap? Personal health practices and coping skills, as we talked about earlier, issues in trusting medical providers. So we may put off getting screened for something. We may put off having an exam. For trans men, pap smears are a very uncomfortable exam. Now, okay, for everyone who's listening with a vagina, pap smears, for the most part, are not very comfortable. But you're going in there. Imagine somebody who looks like me with a beard and an M on their health card going in for a pap smear and having to explain, okay, I'm not in the wrong place. I'm here because I have a vagina, and I'm here because I have a cervix, and I need to have that checked out. And we're not just talking about the discomfort of a cold metal thing that looks like a duck mouth being shoved somewhere where it should never go. I was doing duck hands, you can't see it. Social environments, many of us experience harassment when we're out in public. And there are things like culture. Some of us are kicked out of our cultural spaces and cultural circles. As I had mentioned earlier with the horrible legacy that colonialism has had on Indigenous cultures here in Canada and the status of Two-Spirit people, in many Indigenous reserves here in Canada, youth who come out as Two-Spirit or trans end up having to flee for their safety because of the lasting legacy and damage of missionaries and European settlers. The cultural practices that taught that this is a blessing, that this is a gift from the Creator, was lost. And I'm sure that there are teachings that are closer to your own culture, where people who once were highly revered are now on the outskirts. Financial and social status. For a lot of us, as I mentioned, $15,000 a year. My rent per year is more than half of that, and I live in a tiny one-bedroom apartment. So imagine the amount of strain that has. Imagine having to travel 1,000 kilometers multiple times a year for a 15-minute doctor's appointment because you can't find somebody in your community to treat you. These are all financial strains, but you have to do this in order to transition. And gender is on here as well. In this case, your gender identity and status as somebody who is trans and access to health services. Well, this is why we're here. We're here to talk about the limitations in accessing services. We're here to talk about the way that some of us are treated by medical practitioners. Some of us go into emergency room settings and experience harassment, or we are refused service, being shut down by the medical community.
I just want to point out, it's not so much gaps. Think of them as canyons. These aren't little things that, you can kind of step over. No, they're not. Having your social system ripped out from under you, family, friends, jobs, all the rest of that. The best way I could describe it is someone having a severe traumatic amputation. That is what it feels like. And that's what you're left with. Imagine somebody coming into your emergency room that's had a severe traumatic amputation and you refuse to serve them, you refuse to help. And they've got to manage with what they've got. It's difficult.
Because a lot of the people who are coming to us are youth, it's important to think about what supports this youth has in their life. Because the difference of having supportive parents and unsupportive parents can be life or death. The suicidal behavior of trans youth with very supportive parents drops 93%. It is so important. And if you have that kind of contact with the parents, to have a discussion with them about how they can support their children and why it's important. And doing this, of course, in a way that they'll be receptive. And even as you can see from this chart, how these youth rate their satisfaction with life and how it compares depending on whether they have somewhat supportive parents or unsupportive parents. And there are many different types of transitions. So for some of us, it goes only as far as a social transition where it's just a matter of clothing, hair, names, pronouns. For some of us, we change our legal documentation. For some of us, it requires hormones and surgery. We need that medical transition for everything to feel right. And there can be other personal goals and ideas for, I don't want to make it sound like there's only one set way to be trans or one set way to transition. Remember earlier I talked about non-binary gender identities like genderqueer individuals, where most of this would not necessarily be relevant. Having open discussions with patients who are trans and not assuming any one of these steps as being part of their journey, because not everyone is going to need the same things, and being open to helping them with whichever goals they have. Most of us know when we are kids that this is who we are. In fact, only 1% first identified at 30 or older. And I'm under 30, so I haven't even reached that milestone yet. For most of us, yeah, we were kids. I first knew when I was 5, and Rita and Dar, who are a little bit older than 30, also knew when they were
12.
very young.
I was 12 when I first became aware. I was dressing and I didn't know why.
And I was about 6. And I didn't know why either.
These are from the Breaking Down Barriers project, and we're going to have the link to this available. Jen is nodding her head. She'll figure out how to make that available.
I'll have the link to these slides posted under the YouTube with the comments, and then you'll be able to download them as well as click on the links.
And Dar has a really good example of the importance of confidentiality. And she can tell this story better than I can.
Well, I'll try to make it short. But first of all, I'm the senior one here, so I guess, but my family and my wife has now accepted me for what I am, and that's of 56 years now. And what happened is that she had a personal support worker coming because of her illness. And when somebody picked her up one evening to take her out to a bingo, somebody had seen me in the house all dressed up. And I mean, I was from outside, mind you, but I wasn't worried about it because of the fact that, well, I'm who I am, that's it. But this person that seen me was a personal support worker. And the next day she was at my neighbor, and she said to my neighbor, who's an elderly lady at 82, she says, did you know that he dresses up next door? And she replied, yes, you know, I know that, it's okay. Oh. And it didn't happen, nothing's gonna happen to me because everything is cool at home, even around my surrounding area. But on some of them, it could have been a catastrophe, period. It could have been a divorce or split up or whatever, or even suicide. But this is confidentiality is so important.
Here's a link. Click it while you still can. Here are some excellent Canadian resources. And so if you think I'm making up the numbers, that as well. There's the 519 in Toronto. Here are some more excellent resources for
Worth
finding
going through.
information. We have a trans lifeline. There's also one in the United States as well. And this is TG Innerselves. This is the program that I facilitate. And Rita and are founding members of TG Innerselves. And so we have, of course, support groups. We do one-on-one support. And here is the contact information if you would like to reach us. Do we have time for questions?
We do have time for questions.
Perfect.
Okay. So thank you, everyone. I'm just going to take this off the slide so that you can see the beautiful faces of our speakers. I'm not being vain and including myself in that. I actually mean Rita, Darlyn, Vincent.
You have a beautiful face too, don't worry.
Oh, gosh. Okay. Oop. Okay, so we've got time for questions now. Let me just bring up the questions bar.
How are our old eyes supposed to read that?
I will read them out for you. I know that we do have them. I'm in the wrong tab. That's why.
Okay. Oh, good. There's lots.
Yes, perfect. Okay, so the first question. Oh, I have two questions. One, in your opinion, how should medical students equip themselves with a better mindset and communicational professional skills to help their local transgender community?
First, if there are resources out there, familiarize yourself with them. If there is a support group, if there's anyone local who is doing this kind of work, being that person that helps connect them. Sometimes that may not be available. And, you know, if you have somebody who comes to you looking for support, unfortunately, you may not be able to refer them, but you can be a huge help just by being there, just by listening, and just by being affirming of this person's identity. Also reading up on some of those resources that we have listed as well. Sherborne, 519, Rainbow Health, those are fantastic resources. The Trans Pulse Project is also another one where you can get a lot of in-depth information about the experiences of trans people, and that's where we had gotten a lot of our statistics.
I'm going to offer something that you can actually do. Go and find a trans person, take them to dinner, get to know them. I'm being serious. Get to know a person rather than an issue. It changes everything.
Mm-hmm. Mm-hmm. If I may just jump in for a moment, is that okay? I just want to add that we've had some speakers, some providers, some advocates from countries where being trans, being gay, any type of non-binary gender, non-binary sexuality, and again, noting that they are two very different things, they're independent, but any non-binary status is illegal. And so we've heard about the persecutions that go along with that. And so we don't want to encourage anyone to not be safe or to out anybody and then implicate them in that unsafe situation. But we are saying get to know people. Do what you can in your area. And remember that our physician from Egypt had said, confidentiality is key, and it's within our Hippocratic Oath to help people. So when somebody comes into your office and reveals that they are trans, be that safety, be that person that can connect, even if they can't even if you can't give them a referral to surgery, you can't provide them with the hormones or what have you, you can be that person for them. You can be that safe space in a war zone, so to speak. So sorry, I didn't mean to jump in there.
I'm glad you put that in there.
Okay, so before jumping to the second, we have a comment, even though it's only halfway through. Oh, sorry, I didn't get to this halfway through, my bad. Just wanted to express the biggest gratitude to the three wonderful speakers for sharing with us such personal stories. Thank you for giving us the chance to hear this.
Thank you. We really appreciate that. See my smile?
So going on to the second part of the question, is there any way that healthcare providers can intervene to make up for the lack of family support or to help build family support?
Sometimes speaking to the families, if you're a family practitioner and you're seeing the whole family, then having that sit-down discussion. I had a social worker when I was in high school actually stay late one day and make an appointment with me and my mom and my dad, and he gave them a trans 101, and that really helped. So sometimes having those discussions, being that one who can help answer those questions that need to be asked, but the person who's coming out is not in the position to answer them. So that 13-year-old kid who's just said, "Mom, Dad, I'm trans," they don't know all the answers. But if you're in a situation where, you sat through this 1-hour video and you feel you can answer some of them, or you've done your own research, then by all means, be that person who can speak up for that child or that family member if they're older.
I'm going to tell you this. Professional opinion with family means more than you'll ever know. Professional opinion from healthcare providers saved my marriage. And that means the world to me. I wouldn't be here if I lost my family. What you say carries so much weight. You can help a family get through. You have the most important position I can't imagine. Can't imagine anything more important than that.
Are there more questions?
I don't believe so at the moment.
Quick, we only have 2 minutes.
So I'll send a call. Oh, I just got my stethoscope caught on the table. So I'll send out a call if anyone has any further questions. Please feel free to post them if you're in the Google Hangout Q&A, post them there. I know that we have a lot of, because of the time zone differences, we have a lot of listeners join into our YouTube videos afterwards and post comments and questions there. Please do so. I will ensure that I pass along any comments or questions, and then we will. Yes.
We'll answer them all. We love answering questions.
Or email directly info@tginnerselves.com. I will gladly answer any questions that you will have.
Mm-hmm.
And I'll make sure his answers are correct.
They might be funny. I can't guarantee that I'll be serious all the time.
If you need some good jokes. Might not be the most appropriate ones, but.
Yes, we kind of get off the rails sometimes.
But we have fun.
Oh, we have fun. The thing is being trans, when you have those moments when you can have fun, they're exquisite. And I try and get in as much exquisite time as I can.
All right, so seeing no further questions pop up, just before handing over for last words, I want to say a huge thank you. Oh my goodness, how do I even start? I mean, this could be an hour session in and of itself. To Rita, Darlyn, Vincent, they have been absolutely phenomenal. They have changed perspective at NOSM. NOSM is our medical school. They have provided a safe haven in Northern Ontario, and I just, every time I applaud your courage and your unwavering love for people and for humanity. You just have such great hearts. And I know that, I mean, we talk all the time about the struggles and the canyons with coming out. And I mean, I've been with you where you've come out on a national stage, you've come out on a global stage, on a local stage. And I feel blessed to be part of that journey. I thank you for having me there on that. And I want to applaud you for that, because I know that there are certainly canyons in the way that, no, Rita, don't cry, you'll make me cry. Rita always makes me cry. So I just want to thank you on behalf of the team. And I know Carlos is watching right now. And I mean, Carlos's first reaction was, oh my goodness, I love them the first time we met. So I'm sure right now he's probably tearing up with us. So I want to say thank you on behalf of our entire team, and from my heart, certainly. You haven't kicked me out yet, so.
She's not getting away. She's ours now. Go get your own.
So with that said, I'd like to hand it over for any final words.
If any of you are going to WPATH in Amsterdam, I'll see you there.
Yay!
Yes.
All I got to say is, please be kind. Be kind to everyone you meet. We're hidden among you, and you never know, even when you're out at a grocery store or whatever. You never know that those eyes that you see, what kind of struggle is hiding behind them. Ours is just one. It's an important one to us. But please, kindness always. Thank you.
Bye.